This video is the Female Reproductive System A&P Chapter 28. So the female reproductive system, it produces eggs, secretes hormones, and nurtures and protects a developing fetus during the 9 months of pregnancy. So you have your ovaries. The female gonads are 2 almond-shaped ovaries. Egg development. Within the ovary are many tiny sac-like structures called ovarian follicles. Each ovarian follicle consists of an immature egg called an oocyte and the surrounding cells called follicular cells. As the egg matures, it begins to undergo meiotic cell division, which reduces the number of chromosomes by half from 46 to 23. The follicle enlarges, a fluid-filled center is formed, and the follicular cells begin to secrete estrogen. The mature ovarian follicle is known as the Graafian follicle and looks like a blister on the surface of the ovary. So there is a picture there. As you can see, it starts small as the follicle. It turns into the ovum, where it then matures, and you have the fluid-filled cavity. Ovulation. So once a month, the ovary ejects a mature egg called an ovum, and this ejection phase is called ovulation. The egg travels from the surface of the ovary and is swept by fimbriae into the fallopian tubes. If the egg is fertilized, it is implanted in the uterus. If the egg is not fertilized, the egg dies and is eliminated in menstrual blood. Once ovulation has occurred, the follicular cells that remain in the ovary develop into a glandular structure called the corpus luteum, which is known as the yellow body. And the corpus luteum secretes 2 hormones, progesterone and estrogen. If fertilization does not occur, the corpus luteum deteriorates in about 10 days and becomes known as the corpus albicans, which is the white body. So there's a picture there of your ovary. The yellow part is the corpus luteum. If it dies, it becomes the white part, which is the corpus albicans. Ovarian hormones. So at puberty, the ovaries begin to secrete the hormones estrogen and progesterone. The follicular cells secrete estrogen, and the corpus luteum secretes large amounts of progesterone and smaller amounts of estrogen. So estrogen has 2 important effects. It promotes the maturation of the egg, and it helps develop the female secondary sex characteristics. So the female looks female because of estrogen, so that includes enlargement and development of the breast, whitening of the pelvis, onset of menstrual cycle, deposition of fat beneath the skin, especially in the thighs, buttocks, and breast. Then you have progesterone. The corpus luteum secretes progesterone. It has 3 important effects. It works with estrogen in establishing the menstrual cycle. Number 2, it helps maintain pregnancy. And number 3, it prepares the breast for milk production and pregnancy, increasing their secretory capacity. Then during the later stages of pregnancy, the woman needs larger amounts of both estrogen and progesterone. So this role is performed by the placenta. So let's review. The female gonad is the ovary. The ovaries contain tiny sac-like structures called ovarian follicles. Each ovarian follicle consists of an immature cell called an oocyte and surrounding cells called follicular cells. The mature ovarian follicle is called a Graafian follicle. Ovulation is when the ovum or mature egg ejects. Once ovulation has occurred, the follicular cells that remain in the ovary develop into the corpus luteum, which is the yellow body. If fertilization does not occur, the corpus luteum dies and becomes the corpus albicans, which is the white body. The follicular cells secrete estrogen, and the corpus luteum secretes large amounts of progesterone and smaller amounts of estrogen. So next is the genital tract. It includes the fallopian tubes, the uterus, and the vagina. So your fallopian tubes are also called the uterine tubes or oviducts. They contain fimbriae, which are finger-like projections that hang over the ovary. So at ovulation, the fimbriae, they sweep the egg into the fallopian tube. So the fallopian tube has two functions. It transports the egg from the ovary to the uterus, and it is the site of fertilization of the egg by the sperm. If the fertilized egg moves from the fallopian tube into the uterus, this is where it grows and it implants to make the baby. And this journey through the fallopian tube takes about 4 to 5 days. So you can have tube troubles, you can have an ectopic pregnancy. This is where the egg implants in the fallopian tube rather than in the uterus. You can have scarring, closing, and sterility. This occurs with repeated gonorrheal infections, and this blocks the movement of the egg through the tubes. Pelvic inflammatory disease, PID. This is caused by an infection of the reproductive tract. It often occurs with STDs, and it can spread through the tubes into the pelvic cavity. Your uterus, it's known as the womb. It's located between the urinary bladder and the rectum. The primary function is to provide a safe and nurturing environment for the growing fetus. So it has 3 parts: the fundus, the body, and the cervix. So here's a picture here. The fundus is the part of the uterus above the level of the uterine tubes. You have the body, which is the part of the uterus from the level of the uterine tube to the level of the isthmus. And then your cervix, which is the part below the level of the isthmus. Let's zoom in. So the fundus is the top. You have the body and then the cervix. The uterus also has 3 layers: the epimetrium, also known as the perimetrium, the myometrium, and the endometrium. So as you see here, peri is the outside, myo is middle, and endometrium is the inner lining. The vagina, it extends from the cervix to the vaginal opening. It's also known as the birth canal. The vaginal opening is usually covered by a thin membrane called the hymen, and the hymen may be torn in a number of ways, such as during intercourse, use of tampons, or strenuous exercise. And then the mucosal lining of the vagina lies in folds called rugae, and they help expand the vagina during childbirth. And it also contains normal flora, which creates an acidic environment that discourages the growth of pathogens. So then you have external genitals, and together these parts are called the vulva. So that is the labia majora, the labia minora, the clitoris, and the vestibular glands. Your labia minora, it helps prevent drying of the mucous membrane. Your clitoris, it contains sensory receptors to allow pleasure. And the vestibular glands, they contain the Bartholin's gland, and they moisten and lubricate. So there is a picture of that there. So let's review. The genital tract contains the fallopian tubes, uterus, and vagina. Fertilization occurs in the fallopian tubes. You have ectopic pregnancy. That occurs if the fertilized egg implants in the fallopian tube instead of the uterus. And you have PID, which occurs from infection in the genital tract. The uterus contains 3 parts: the fundus, the body, the cervix. The uterus has 3 layers: the epimetrium, the myometrium, and the endometrium. The vagina is also known as the womb or birth canal. And then you have external genitalia, which are the labia minora, labia majora, clitoris, and vestibular glands. So I'm going to go ahead and end this video here. This is part 1. and part 2, I'll be covering the hormones and the menstrual cycle and methods of birth control. So go ahead and click on that next video.